He was just 35 years old, healthy looking, able-bodied young man. Came complaining of cough of about 6 weeks duration. Has taken several liquid medications, cough syrups, and visited pharmacies and clinics without resolution of the cough. But what he didn't know was that cough wasn't just ordinary cough. Hi, welcome to the 3rd episode of Patient Case Files with Dr. Happiness. In this video, I bring to you a patient, a young man, who has been having cough persistently for 6 weeks, sought solutions, but the cough wasn't just going. What he didn't know, and what we didn't even realize initially, was that cough was much more than an ordinary cough. For those of you who are joining us for the first time, this is a series in the Health and Wellness channel with Dr. Happiness. I am Dr. Happiness, your trusted guide in family health and wellness. In this channel, I try to simplify health issues so that you will understand what we physicians deal with behind closed doors in our consultation rooms and how we go about arriving at our diagnosis and getting solutions for patients. So this patient is 35 years old, a young man, apparently healthy. He's been coughing for close to 6 weeks. The cough, sometimes dry, sometimes productive, but there was no blood in the sputum. There's no history of weight loss. He had neither smoked, and he's not an alcoholic. He doesn't work in an industry. He's an IT person. So this cough has been persistent. He has bought several cough syrups. He has visited some clinics. And he has even gone to pharmacy shops because the cough has been embarrassing, both at home, in the office, in the bus, and in the market. He kept coughing. So when he came to our clinic, gave this complaint, I asked him questions. Do you smoke? He doesn't smoke. Does he have somebody that has been coughing for so long around him? He answered in negative. He doesn't have fever, no weight loss, no chest pain, no other complaint. His vital signs were normal. And so, I proceeded to examine him. On examination, every parameter was okay. He didn't have night sweats, as I complained, because I was thinking of tuberculosis. There was no history of night sweats, and no blood in the sputum, and no weight loss, as I said before. So I decided to send him for sputum culture, AFB, to check for tuberculosis, to check for bacteria. I even sent him for gene expert tests. All the results not negative. A young man neither has tuberculosis, nor pneumonia, nor any viral infection, but he was still coughing. So, what was the next thing I did? I had to send him for a chest x-ray. The chest x-ray came out, and what we saw was beyond our imagination. This is the right place to like this video and share it with others that might find value in it. So what do we see? What was our finding in the chest x-ray? The chest x-ray showed an area in the right upper lobe of his lung that's consolidated. Now, if there's consolidation, tuberculosis could be part of it, but this guy's results showed negative to all the tests for tuberculosis. Now, the next thing to suspect was something much more sinister than tuberculosis. So I sent him to go for histology. In fact, I sent him to a pulmonologist. A pulmonologist is a doctor that is an expert on health issues that have to do with the lungs, the pulmonary system. So the pulmonologist sent him for a biopsy of that area of the lung that showed consolidation. It showed a nodule. A biopsy was done. He was also sent for either CT scan or PET scan. Those are specialized tests used to examine tissues like the lungs and other parts of the body. PET scan and the histology of the biopsy tissue confirmed my suspicion. Our young man has lung cancer, stage 1. Now, lung cancer is not as uncommon as you think. And most times, what is unusual in this case is that lung cancer is more common in smokers. But this young man has never smoked in his life. It could be he's a secondary smoker. He has been around people that smoked, and so he has inhaled it. And so, lung cancer is not only seen in smokers. It is more common in smokers, but anybody can have lung cancer. The good news about this young man's own is that his own is stage 1. That means the cancer is just restricted to less than 5 millimeters or centimeters around that part of the lung. It's just on one lobe of the lung. It has not spread to other parts, so it was caught early. So what was the treatment option he had? There are different ways of treating lung cancer, and the options depend on the stage at which the cancer was seen or was diagnosed. It can be treated through surgery, and in this my patient, surgery was done because that lobe, that part of the node and the lobe was removed. It was lobectomy. That was what they did. That it will not crop up again because they remove it with part of the normal tissue. So he still has his right and left lung, only that the right lung has lost a lobe of it. Now, there are other forms of treatment apart from lobectomy or surgery. Lung cancer can be treated using chemotherapy or immunotherapy or radiotherapy, or a combination of one or two of this mode of treatment. If it is seen early, like in most cancers, the survival rate is very high. So, when next you have cough that's persistent, don't just sit back and say it's ordinary cough. It might be much more than an ordinary cough. Our patient, 5 years now, is still bubbling. In fact, he's bubbling with his family. So take care of your health. Be in charge of your health. Don't ignore any symptom. It could be a warning sign of something more serious. If you found value in this video, I would like you to share it so that others may benefit. Subscribe and like this video to encourage me. I am Dr. Happiness. And remember, let's together build healthier and happier families.